And I'm Elizabeth Caledon on how a simple aspirin may show us how drugs work differently in men and women.
And he gets his stolen car back after 37 years. I'm Bill Whitaker with the happy reunion of man and machine.
This is the CBS Evening News with Bob Schieffer.
And just ahead, millions take aspirin to help prevent heart attacks, but a new study shows it works differently for men and women. We'll have the details in just a minute. Millions of Americans take a daily dose of aspirin on doctor's orders, and while this inexpensive pill can be a lifesaver for both men and women, it apparently protects them in different ways. Medical correspondent Elizabeth Caledon now with the story. Elizabeth?
Well, Bob, what we know for sure from the study out tonight is that at least one drug works differently for men and women. But this is just the beginning, and doctors tell us that this research could ultimately lead the way to major changes in the way drugs are prescribed. The drug is aspirin, probably found in most medicine cabinets in America. But here's something you may not know about this common compound. Men and women taking aspirin to prevent heart disease will have completely different results. According to the newest research, in 95,000 healthy patients with no prior heart problems, an aspirin a day reduced risk of stroke in women by 17%, with no reduction in heart attack. While in men, the aspirin cut heart attack risk by 32%, with no reduction in stroke. It's no surprise to Dr. Nieca Goldberg, who specializes in cardiac care just for women.
You and I know men and women are different, but we really need that to be appreciated in the healthcare system.
That's pretty good.
Goldberg says it's high time trials of all sorts of drugs start looking at the sexes separately. Her patient, Ruth Oakes, thinks it's common sense.
I think that's why we need to do separate studies with every drug.
Aspirin is just the beginning. There's evidence that some antidepressants, even anesthesia, work differently in women. Among the theories, women are smaller, have more body fat, and tend to take more drugs than men, like birth control. Not knowing these things for sure makes Dr. Goldberg's job more difficult.
You know, we don't even know if maybe women should be on lower dosages of medicines compared to men.
Many physicians, just like Dr. Goldberg, are hoping this one study on aspirin will kickstart a brave new world of something called gender-specific medicine, a field badly in need of further study. Bob?
Well,